Alright, this is my abdominal assessment pass-off. So here I go for Andrew Carden. Alright, this is my patient, Drew. He is a 5-year-old male here for his checkup. And we're going to do an abdominal assessment on him. First of all, what I'm looking for is looking at the general skin and overall appearance of the abdomen. I'm looking to see if there's any nodule or apparent masses, any differences in color of the skin compared to the rest of the body. Looking for striae, any bruises. I'm looking for any noticeable peristalsis or movement due to venous and arterioles. I'm looking at his umbilicus. It's medial. I don't see any redness or appearance of swelling or any herniation. So then I'm going to listen to all 4 quadrants of his belly. I'm going to use the diaphragm. Let's be nice and quiet. They're neither hypo or hyperactive. I hear bowel sounds nice and clear in all 4 quadrants. Now I'm going to use the bell of my stethoscope. I'm going to listen to rubs over the liver and the spleen, which I don't hear. Now I'm going to listen for some bruits over the aorta, renal, iliac, and then femoral. Which I don't hear. All right, now I'm going to go on to percussion. Percussion, I'm just going to do some general percussing around the stomach. I'm going to notice for the gastric bubble, which I can hear right there. It's nice and tympanic. Now, since I'm in this position, I'm going to go ahead and look for the liver borders. So I hear a change there, so I'd mark that. Let's start here. It's about right here. So in adults it would be 6 to 12 centimeters. Since he is a child, it could be less than that, and it's well within that range. We'll say about 4 centimeters. So now I am going to do some palpitations, or actually I'm going to do the spleen. So again, I'm going to just kind of percuss around the 12th intercostal space. Can you breathe in? Take a big deep breath in. Breathe all the way in. And I don't have a change in percussion, so that should be normal. He is a little skinny, so it might be possible that I might be able to tell a difference. Now I'm going to go, while I have him here, also percussion. Can you sit up, please? Check for CVA tenderness. Since he's a child, there's a lot less fat and other tissue that's going to block it, but I'm just going to do a light percussion. Tell me if that hurts. Does that hurt? So no CVA tenderness. Okay, you can lay back down. Thank you. So then I'm going to do palpitation. First I'm going to do light palpitation. And I'm just going to do some general touching, so you let me know if any of this hurts. Now if you were ticklish, I could try and have him put his hand there first and then see if I can move it. I don't notice any nodules, any masses. There was no pain or discomfort on palpitation. Now I'm going to do more deep, and I can either use one or two hands, but on a child I would just use one. So again, tell me if any of this hurts. Now while I'm in this area with the liver, I can have him take a deep breath in, and I'll push in. I'll see if I can feel the liver. I don't feel the liver, although it might be easy, but it's well above the lower costal region, so no enlargement there. Same thing, can you breathe in deep? Pull up, see if I can feel his spleen, and again, I can't feel his spleen. Now again, while I'm in this liver area, I can also press down and see if there's the Murphy sign while you take a deep breath in. If I push and there had been pain for possible gallbladder stone or obstruction, he would stop breathing at that moment, but again, no pain on that. So now I can check for the kidneys. So one way I can do that with the child is kind of the cup method. So I'll lift up his back, lift up, and then take a deep breath in. Okay, hey, let's go. And I might be able to feel his kidneys since he is so small, both left and right. And I would do the same on the other side. Take a deep breath in and out. Okay. Now, same thing that goes with the spleen. I would lift up his back and try to palpate his spleen. So I'm pushing the spleen up towards the body. If you take a deep breath in, and I'd feel again no spleen enlargement or liver enlargement. Again, while I'm here, I might palpate the aorta. So I can use two fingers. If I were able to feel it, I'd want to see if it's enlarged, which it isn't, and then I might want to check how it's pulsating, if it's pulsating down like it should, or if it's pulsating out, which might mean there might be some sort of aneurysm in there, but again, it's flowing downward. I don't feel any outward pulsations. Then I would check any lymph nodes in the area towards the femoral region, and there's no noticeable lymph nodes there. And then also femoral pulses. Then the last thing that I can do, say he was complaining of stomach pain. With kids, it's a little different. It might just be general stomach pain. So I could have him do several things. Something similar in adults. He is 5, so he can kind of explain some of these things, but in an adult, you could do the obturator sign, which while his knee is up, can you bend your knee? Bend it. While he's in this way, I can move his leg back and forth, and if he feels any pain, that's a positive sign. Then the iliopsoas is the same thing. Now this time I want you to push up against my arm, my hand. So he's pushing up. If, again, he did have pain, he would get that pain and let me know that it's there. So other things that we might look for is the Robson sign, rebound tenderness, where in the general region I would push and release, and during that release, if there was pain in that area, it would cause more pain. And then the other thing is if I push away, so if we're talking about the right side, on the left side, I would push, and at the same time, if pushing on the left side causes pain in the right side, that's also a positive sign. Now, in terms of ascites, right now he doesn't have any ascites, but while I was doing any general percussion, I can notice the change where it goes from tympanic to dullness. So say it's there, I would mark the region, and then I could have him lay on his side, and I would do the same thing, and I'd see if the borders overlap or they're different, and if they are the same, then he doesn't, but if they change, then it would be a positive sign for ascites, but that doesn't catch all ascites. If there's less than half a liter, it is very possible that it will not be caught. And then the last thing we can do is, if I did find any masses, to be able to find out if they're superficial or below the abdominal muscles, I'd figure out where they are and palpate them. And then what I could do is, can you lift your head up? Just lift your head up. Have him flex his stomach muscles, and I'd feel again. And if I could no longer feel them, then that means that they're deep underneath the muscle tissue. If they're still there, then they'd be superficial. And I believe that is my exam. This boy is nice and healthy, and he's a great helper. Can you say hi to the camera?
Hi.
Say hi, and we'll see you next time. Thank you, Drew.